Hey, it's Dr. Dunaway with Chiro Strength with video 2 of a 3-part series, and this video is all about mobility. And so we have to prep the tissues with the first video because the hydration of the tissues is very important so they respond well to this. We're going to talk about calves first and then a lot of hip stuff to kind of loosen up all of the lower body. And so when you're running, you can run with less tension. The first thing with the calves, I'm going to start with actual calf raises because a lot of tension in the calves comes from feet instability and ankle instability. And a good way to tell if you have instability is if you do a calf raise and your ankles come out or your heels come out, so they start together, they end up kind of rolling out. That's a weak foot, weak ankle. That calf is never going to relax down. So we're going to do some calf raises to, again, pump the tissue with blood prior to stretching. And I'm going to use a ball and I'm going to hold it in between my heels and just do some slow calf raises. So I'm here, ball in between my heels, and I'm going to slowly come up and down. And I'm just going to squeeze that ball between my heels as I'm doing these calf raises. We're going to do 15 to 20 of those, and then go into 30-second static holds of the calf in 3 different positions. Position 1, 30-second hold, go to the other foot. Position 2 is going to be toe out, 30-second hold, go to the other foot. Position 3 is going to be toe in, and 30-second hold, and go to both feet. Okay, so that's going to be the calf routine. Then we're going to go on to what's called a tactical frog. This is going to be great for hamstrings, adductors, a lot of the tissues that are here and here that get real tight. Tension on the inside of the leg will pull the knee this way and create that IT band issue. So it's really important if you have knee pain or IT band issues, pay attention to the other side of the joint here because that's going to be what's really kind of pulling that kind of tug of war and creating that tension. So hands and knees like this, my feet are behind me, just kind of lay down on the ground like this. And all I'm going to do is try and keep a good arched back, chest up, and I'm going to rock back. Rocking back, and you'll feel the tension in the hips build up as you do that from the side view. Looks like this. And I'm going to spend about 30 seconds going in that position. And then I'm going to come down to my forearms, and as I come back again, it'll stretch a couple different areas of the hip capsule. So after I do this for about a minute, I'm going to come back on my hands, put one leg straight out like this. Again, chest up, don't round your back as you go back, slowly push back, and that'll get a good kind of mixture between the adductor and hamstring stretch. My foot's flat on the ground right now, but as I rock back and come up a little bit, and that'll be a really good kind of rocking mobility routine as I'm trying to loosen up the adductors. So the last one's going to be hip flexion. Hip extension, Without good hip extension, you're not going to get gluteal activation. Without gluteal activation, you're going to beat up these knees, okay? So the last one, and maybe the most important one, aside from the bottom of the feet, like I talked about in the first video, is a good hip flexor stretch is going to include a posterior tilt of the pelvis. So this pelvis coming back, and as you do that, you see the front of my hip push forward. And as I come forward like this, that is all of the anterior shift I need to get a stretch here. If you're stretching your hip flexors like this, you're not stretching your hip flexors. You're falling into the capsule. So I want to stretch the tissue right in front of the hip. And I can do that by just tucking my butt underneath me, leaning forward, breathing. Again, we're going to do about a 30-second hold. As we're holding this, I can reach up and away. And as I really reach up, I can really strengthen or lengthen this hip flexor, or the psoas portion of it. And then I'm going to slowly turn into it because that's going to really get a muscle called the pectineus and lean into this like that. And then, again, both sides, spending 30 seconds to a minute on each side because that hip flexion is so important. But those 3 mobility routines will kind of capture a lot of the tension and tightness that I see in runners. And it's just important that you follow the soft tissue work prior to this. And again, this will probably take you about 5 minutes to complete all of those.